And good afternoon, everyone. Thank you to our community and to our members of the media for being with us here this afternoon. It is a new week, and much has changed as it relates to COVID-19 and its impact here in Orange County. Thanks for being with us on this press event. With remarks today, in this press event today, are Orange County Mayor Jerry L. Demings, Orlando Mayor Buddy Dyer, Dr. Raul Pino, Health Officer with the Florida Department of Health here in Orange County, and our Sheriff, Orange County Sheriff John Mita. Members of the media, please remember to ask all of your questions at one time to minimize our mic runner from his activity, and he can keep his social distancing as well. To start us off with the information for this brand new week is our Mayor, Jerry O. Demings. Mayor.
All right, thank you, Dr. Williamson. Good afternoon to all of you. I hope that you had a blessed Easter period of time here this weekend. As we move forward as a community, you can see the backdrop behind me. The state of Florida now has well over 20,000 different cases of positive COVID-19 incidents here within our state. Some 470 individuals, unfortunately, have died of the virus, so you know that it is a serious virus. As we move forward this afternoon, I'm going to talk to you a little bit about our experience here in Orange County. Today, we have some 1,017 different cases in Orange County and 13 deaths. When I look at those 1,017, it was almost exactly 1 month ago today that we actually began to staff our Emergency Operations Center here in Orange County, and that we have continued to do now 7 days a week. And there's a beehive of activity that goes on in our Emergency Operations Center. I have to say thank you to the men and women from the various disciplines who have helped to staff the Emergency Operations Center during that period of time. They have kept us operating where there's a daily focus on this pandemic in our community. And by and large, they've been very, very responsive. They have remained in contact with the state of Florida as well as the federal government as we prepare to respond to the future of this pandemic. When I think about where we are today, we're seeing some deacceleration or leveling off of cases in our area. Recently, there were numbers that have been provided to me by Dr. Pino that have been really encouraging. When I think about where we are, one of the predictive models that was out there said that we should peak this week. The week of April the 12th through the 19th was that period of time. And so when we see the deacceleration of cases here within our county, that really means that there's a flattening of the curve, which is what we all were aspiring to do, was to see the curve flatten in our community. And I believe that because of many of the measures that we put in place as a community, they have been effective. One of those measures that you see people, I think, readily agreeing to do in this community is the wearing of different protective masks. And I see many of you here today are wearing your mask. Generally speaking, when I go out in the public, I do wear my mask to protect myself and perhaps to protect others as well. And so we strongly urge individuals in our community to wear masks where appropriate. I'm aware that one of our neighboring counties had issued a mandate requiring people to wear masks. And today, I understand they issued a qualifying executive order that essentially did away with the penalty phase of that executive order because I'm going to assume their general counsel felt that there were portions of it that was unenforceable. Well, we really don't want to be in that position. And we had a conference call earlier today of the executive policy group here within Orange County. And the executive policy group consists of myself as the mayor of the county. During a state of emergency, I become the county's emergency manager countywide. But we have participation from our municipalities as well as the other constitutional offices within Orange County. That includes the sheriff, the clerk of the courts, etc. In addition, the chief judge for the circuit. And the chief judge in this circuit is the judge that presides over Osceola and Orange counties. And we deliberated whether or not it would be appropriate for Orange County at this time to issue such an executive order that would mandate the wearing of masks. With the collective experience and knowledge between our health officers and those of us in other elected offices, we mutually agreed that we didn't believe that it was the appropriate thing to do in our county, that it would create challenges with enforcement. And we have a bit of a challenge with providing adequate protective equipment or masks within our community. I can tell you that through the state processes, we have requested over 230,000 different N95 masks through the state system, and we received about 15.2% of that, or a little over 36,000 mask. And so if we require something to occur in this community, we have to ensure that the electorate has the reasonable opportunity to comply with that order. And it would have created somewhat of a challenge, I think, for the sheriff. I don't mean to put words into the mouth of the sheriff. He can speak for himself here. But I believe that it would have created a bit of a challenge for law enforcement to enforce that order, especially given the challenge we have with having enough protective masks for everyone. But we do strongly urge our community that it is, I think, a good health protocol that you mask up during these periods of time. Because we have seen this flattening, there's no time for us to rejoice at this point and say that we will retreat from any of the social distancing guidelines that have been put out. I think this is the time for us to really double down, to run through the finish line here so that we can continue having a positive impact on reducing the spread of the virus here in this community. In terms of where we should be headed now, I think that more testing is needed. It is our desire to do additional testing in all areas of our community. When you look at the heat maps that are over here, out of the 53 zip codes, we now have at least one person who is tested positive in 49 of those zip codes, and that was as of about midday today. Perhaps at some point there will be a person before this is over that has tested positive in every one of those zip codes. So this is still something that is very, very active in our community. But to see the flattening of the curve is a positive direction that we'll ask Dr. Pino when he comes up to speak more about the data analytics that we have at this point. As we also move forward with the press conference, I want to acknowledge several of our community-based organizations that have been good partners, good stewards to our community. One is the Guangming Temple off of Hoffner and Cimarron. That temple, Buddhist temple, donated some 4,000 surgical masks that have been redistributed within our community. And we appreciate all of our community-based organizations who have assisted with either the donation or the making of masks. We still need more within our community. At this point, I'm going to ask Mayor Dyer to come forward and to share some additional information with you, and then we'll move forward with the press conference. Again, thank you for being here.
Thank you. Thank you, Mayor Demings. You know, we are seeing a flattening of the curve, and it is absolutely a consequence of the commitment that this community has made, and we need to keep doing exactly what we've been doing, and we'll see results of our responsible actions. So we need to continue fighting this together. It's no time to relax, and we have to fight it on many fronts, medically, economically, and with community resilience. And Like Mayor Demings, I want to again thank our hospital partners and our medical professionals who are on the front line serving and fighting and saving lives. So we can help them. Every single one of us can help them by staying home, by wearing face coverings, washing our hands, practicing 6-foot physical distancing when we're outside. Now, through this crisis, we have not forgot about the most vulnerable. Through the coordinated efforts of our Commission on Homelessness, our community partners have been working together to make sure that all of our providers understand the guidance from the CDC. During today's City Council meeting, our virtual City Council meeting, we approved funding to support the Salvation Army's expansion of their men's shelter operations to provide 24/7 for approximately additionally 50 more beds, and they are spaced 6 feet apart to meet CDC recommended distances. We're also providing funding to a local not-for-profit, SALT, which will provide access to showers and restrooms and clean clothing and hygiene kit. We have also partnered with the county, the health department, and the Homeless Services Network to open a isolation and recovery center for a dedicated place for homeless individuals who have symptoms or tested positive for COVID-19. Fighting the pandemic from an economic perspective and helping our economy rebound is going to take a partnership of governments and the business community at all levels. And right now, our priority is to make sure that Orlando, Orange County, Central Florida gets its fair share of the $2.2 trillion from the CARES Act. At today's City Council meeting, we took a first step to enable us to move forward to receive funding through the HUD portion, which will allow us to use funding to expand capacity at hospitals and providing essential services. We know there are few, if any, businesses that haven't been immune to the impacts of this pandemic, and we want to do all that we can to make sure our local businesses take advantage of the CARE Act programs. So we've started a new email series to provide updates to all of the businesses that are registered with the city through the business tax receipt. We continue to fight for and advocate for all of our businesses. And the best thing we can do for our businesses is continue to flatten the curve and shut this virus down and do it together. Lastly, I'm just, again, always so proud of how we've continued to strengthen our community while we're apart. We saw that this last weekend when so many churches and families used their creativity to organize different Easter celebrations, all the while using social separation. We saw that connection with neighborhood associations that are delivering care packages to their at-risk neighbors, teachers who are still impacting their students and not just in person. And this resiliency and strength of our community should all give us hope. Just as we've rallied together to stop the spread, we're uniting to support one another. Dr. Pino.
Thank you, Mayor. As Mayor Demings said earlier, we have 1,017 cases in our county, and that's a cumulative positive cases. And the age range continues to be the same from 0 to 101, with an average of 46 years old. That has come down a year. And we continue to have 13 deaths. No additional death has been reported to the state. The data, the mayor was talking, both mayors have talked about the flattening of the curve, and we are looking to several data sources to come to that type of assessment. I think that there is a deceleration in Orange County, but it doesn't mean that it's permanent. It doesn't mean that we have to, that we are out of the woods yet. That is not the case. We need more data to be able to assess if we have peaked already, which is one of the, always what you hear about it. And some places, they peak twice. And in some cases, it's related to the fact that people kind of relax a little bit and then don't use the protection measures that has been put in place. We are also looking at hospitalization rates, the number of percentage of tests that become positive with regard to the entire sample. We also look at viability of beds and ventilators. And as well, we are looking at the age of the people who are hospitalized. And if you can see in the graph, and when you compare to other counties, it may have to do with the fact that our county has a large segment of our population is younger. And so the highest number of our cases concentrate between 24 and 64. Which is put a lot of our people who are positive out of the range of the most dangerous outcomes that we can see, which is above 65 years old with pre-existing conditions. As the mayors also mentioned, the Department of Health is rapidly planning this week to engage in mobile testing. We have selected 5 sites. We are proposing 5 sites. 4 of them are parks, and 1 in downtown. As soon as we have those sites confirmed, we will make an announcement about what dates we will be there. We are expecting to do about between 250 to 300 tests a day in each of the sites. And what is stopping us is to have enough test collection kits, that is, to be able to make it entire round through the 5 sites. I have secured about 1,000. We will need another 500, but I think we will get those to be able to do as well. The sites were geographically selected, taking in consideration the heat map, the areas that we have the highest health disparities, but also geographically distributed across the county so that everyone can have access to it. And again, those will be done by appointment and open to anyone, and they will be free. By appointment, we will be able to take the appointments on the phone. The realization that we won't want people to be waiting in line for 5 hours to get tested, so that we are going to stagger. Temperatures are getting hot, and so we want to protect our employees as well as the public. I will answer any questions that you have, and so that I don't forget about Sheriff Mina, it was put here in my piece of paper.
Good afternoon, and thank you, Dr. Pino. So as we enter another week where this is all our new normal, I want to say that I'm extremely proud of our community, and I will echo what Mayor Demings and Mayor Dyer said, that the measures that we put in place as a community are working, and we can see the effect of that. I do want to offer a special thank you to all of our telecommunicators. It's National Telecommunications Week, so all of our 911 dispatchers and call takers, this is their week for all of us to thank them. They are on the front lines with our law enforcement, and like us, they cannot stay at home. They have to come to work, and they're really the first responders. So thank you to all our 911 dispatchers and call takers from all the jurisdictions within Orange County. So at the Sheriff's Office, our personnel are continuing to respond to calls using their protective equipment and gloves. And, we continue to see a decrease in overall crimes and overall calls for service when you compare the period of the stay-at-home order compared to the same time period before. But we have seen increases in drug overdoses and those who are committed involuntarily under the Baker Act, and I'm sure there's a slew of socioeconomic contributors as well as isolation and anxiety that goes into those. So that's something that at the Sheriff's Office and our other municipalities we're going to keep a close eye on, and want our community to keep a close eye on as well. So again, we all know that the first responders are not immune, as we've had 5 tested positive. We're happy to say that the first one who tested positive, he is now back to work, and all the other deputies, the 4 other deputies, are all resting at home and definitely on the road to recovery. So as we celebrate the small victories, now is not the time to be complacent. I still want to urge everyone, although we're seeing this flattening, as was discussed, that we need to adhere to the stay-at-home order. We need to adhere to the curfew. I am proud to say that, like Mayor Dyer said, we didn't receive any complaints from any of the people or about places of worship or churches. Everyone used those good social distancing measures in place, so we're very happy with that. We still are responding to some large crowds, so that just this weekend we did respond to a large gathering out on the west side of Orlando where there were several people in violation of the curfew order after 11 o'clock. So in lieu of arrest, we did issue 4 notices to appear. So I say that to tell people that although we don't want to make arrests, we don't want to take enforcement action, we will do this to save lives while the stay-at-home order is in effect and while our curfew is in effect. So the curfew is still in effect every night from 11 p.m. To 5 a.m. And again, we will take enforcement action, although that we don't want to do that. So, staying at home greatly reduces our risk for exposure and helps stop the spread. But I also want to strongly urge the wearing of the mask. This is the mask that my wife made me, that I wear when I'm out in public. So, again, from the law enforcement perspective, I'm glad that we all got together, the executive policy group, and made this collective decision about not making it a mandate. So, I was at the grocery store this weekend. Probably 99% of the people had masks on. Everyone, I think people get it. I don't think law enforcement needs to make people wear a mask, and certainly we didn't want to be put in the position of trying to force that, especially in some of our more challenging areas where we already have issues related to crime. I think that, again, would just continue to lessen the trust that some areas may already have in law enforcement. So, but we are strongly urging you to wear your masks. It's going to save lives. We need to continue not only flattening the curve, but we need to continue to see that go down. And for our Spanish-speaking viewers, muchas quédate en su casa. Stay at home. Thank you.
Okay, we'll take some questions from any one of you here in the audience.
Hello, Lauren Seabrook, Channel 9. A couple questions for you, Mayor. If we did not have this shortage of masks and shortage of PPE for our hospital workers, would this, non-requirement to wear a mask, would you have treated it differently, do you think, if everyone had access to it?
We may have treated it differently, but again, I think there are challenges with the enforcement side of it. To have law enforcement enforcing that creates a host of challenges that I think as a leadership team here, the executive policy group thought that that was not the right look, the right solution for us, particularly since we are getting so much compliance from our residents already. So we try to reward when people behave appropriately. We reward them with, a positive, I think, sense of enforcement.
And also, have you been listening to what the president has said about wanting to open the economy back up in May, possibly? And what are your thoughts on that? How could that impact us here?
We all want to open the businesses back up as soon as it's reasonably possible for us to do that, and I think safe for us to do that. So I will look to the healthcare community, the physicians, with the science that says that that's an appropriate period of time. I believe that because of many of the measures that we put in place, we are seeing the flattening of the curve happen now, which does suggest that we should look at some point to relaxing some of the restrictions that have been put in place. That has to be an orderly process. That is not something that is going to happen overnight. We have to plan for it. And so our goal is to, by the end of this week, to really have a leadership group of business persons, small business and large corporations that will work together to work with the public sector to plan what that looks like when we do decide to reopen. Much like after 9/11, the world changed in terms of the airport security, security at our seaports, etc. And it won't ever go back to where it was before 9/11. After this pandemic, we're going to see the same thing happen. There will be a change in the sanitary protocols and I believe some of the regulatory requirements for businesses that serve food or other products or handle drugs and other things. I believe that you're going to see new mandates that are going to be codified in law, whether that's federal, state, or local, that will give further guidance to businesses as they reopen. We have to think through all of that, plan through that, so that we do not have unintended consequences of that process. So I hope to, by the end of this week, make an announcement about who that team of individuals will be put in place to work to help ensure that we have an orderly transition.
And just one question for Dr. Pino. We hear a lot nationally about these antibody tests. Is that something that you're hearing that we may have a possibility to get here locally? And if so, how could somebody get tested, or how would you know if you should be one to be tested?
Yeah, so those are not available now yet for the public in general. We at the department requested one of the machines to try it and see what happened. So for the general public to know, an antibody test is after the fact that you develop immunity to a specific disease, so you develop those antibodies, and it will measure how reliable. I think we will go through the same that we have been through every single test, but the importance of that is that it's going to give you an idea of penetration into the community, because you could see a large number of individuals that didn't exhibit any symptoms but were carriers of the virus, and what their role was probably even higher than we thought initially in the transmission of the disease.
Ryan Gillespie at the Orlando Sentinel. Questions on two different topics for you. I'll just go one at a time. First of all, I know you said last week you talked to the hospital systems and they all kind of had different projections on when we're going to peak here. How do you kind of take that information into planning now? What are you kind of anticipating as the peak in the coming days, weeks, however long it could be?
After meeting with the hospitals, they had predictive models that said that we would peak this week. One model said that it would happen around April the 21st, next week. And another model said it could be as late as May the 5th or 6th. But again, when we see new cases but less hospitalization, to the healthcare experts, I think that means something to them, especially if that occurs for several weeks. I believe that we can then use the body of knowledge gathered from medical science to help us with projecting when we reopen for business, et cetera. So if it doesn't happen, there's some that suggest we may have already peaked. And if we haven't, we still want to plan for even the potential that there could be a resurgence of the virus in late summer. We don't want that to happen either. So we know that if you all are like me, what I say to my family, let's get this done now. I don't want to have to go through this again in 2 months. So if we can be uncomfortable now, we don't have to repeat this. That's the goal. We do not want to repeat this. So that means we have to run through the finish line. We cannot just cut off the restrictive policies that have been put in place now and expect to have the kind of results in 2 or 3 months from now. Am I right? All of you all with me on that? We do not want to have to go through this again. Okay.
And secondly, the WWE, which is taping their shows here in town, announced last night they had one of their, I believe it was an onstage performer, test positive. Are you aware, are they deemed an essential business, or did they get a special exemption to stay open, or are you aware of how they're able to?
I think initially there was a review that was done, and they were not initially deemed an essential business. with some conversation with the governor's office regarding the governor's order, they were deemed an essential business. And so therefore they were allowed to remain open. In terms of the specifics associated with the wrestler or personality who tested positive, I don't know any of the details of that, obviously, because of HIPAA laws, et cetera. I don't know that, but that's like a little family, a small family of professional athletes that wrestle, and if one of my family members tested positive in my house, that would be concerning to me. We would have to make some provisions in my house to make sure that the rest of us not get infected. And so I would assume that from a business perspective, the WWE is doing that type of analysis of its own family. Okay.
Yeah, I had a question for Sheriff Mina, and I do want to ask it, but first, you mentioned something just a few minutes ago that I think I need to follow up on. I don't want to belabor the point, but the issue in Osceola County really isn't a matter of how hard it is to enforce it. They don't really have the legal authority to do it. And so I want to have an understanding here that we're not going to come later and be like, oh, we can make people wear whatever we want. You understand what I'm saying? I mean, it seems like you're maybe kind of tiptoeing there.
Well, I mean, we looked at the legality of it, and it's a complex issue. In some cases, clearly the government has the authority to regulate, I think, health-related matters within a business. The Department of Health regulates, certain things that have to happen regarding the serving of food, et cetera, et cetera. But we don't want to have an overreach either. We want to balance that with the true need of having to take a causative action. We, amongst ourselves today, had that deliberation, and again, we just didn't think that was an appropriate thing to do in Orange County. So the issue of whether it's legal or not really is a moot issue for us because we didn't take that action.
Okay. Sheriff, in Philadelphia, just a few days last week, a guy was dragged off of the bus for not wearing a mask, which he wasn't required to do. In Miami, there was a doctor, he was unloading supplies for the homeless that was handcuffed by a police officer. Those are just a couple of examples of officers around the country that have kind of gone across the line. What kind of conversations have you had with your own officers to either make sure that doesn't happen, or what kind of other consequences do you have in place in case it does?
So first, we're recommending that our officers, really lessen their amount of self-initiated activity. So in other words, there are people still out there committing crimes, some very serious crimes, and those are the people that we are focused on. We're, having our deputies and officers in all the municipal jurisdictions really, only go after the worst of the worst. So in other words, we're not going to be pulling people over for a minor traffic violation, but if that person is going 75 miles in a residential neighborhood, we are going to stop the person. We're telling them to maintain safe distance, and so probably the situations that you brought up is that was one of my concerns in any type of order. But a lot of that's common sense too. But we didn't want to have to go and say enforce a mask order against someone who was homeless and standing on the side of the road and may not have access to the bandanas and things that other people have.
Hi, I'm David Porter with 32805 RL News. So I cover the marginalized communities in west of downtown. All of you talked a lot about the importance of, I hope you can hear me, this is weird talking about this, about wearing masks. But we also heard from people in the black community who are nervous about wearing masks because they're really afraid of racial profiling. They're afraid that they will then lead to some kind of encounter with the police. And I got to tell you, last Tuesday, I got felony stopped at iDrive after taking pictures, at the site where they were doing the testing, and it's very scary, and it's also very embarrassing because people going by. I mean, I got stopped by like 5 deputies and pulled out my car. It's very embarrassing. So I'm trying to find out what is the message, and especially to you, Mayor Demings, as you're in a unique position as you're a native of Orlando. You've served as police chief. You served as sheriff. And I think the sheriff wanted to say something. What is your message, number one, to people about the importance of wearing masks? And number two, for both of you or either one of you, what is the message about racial profiling? Because even when I go into a store and I put this mask on, I feel very uncomfortable. You know, we've seen black people arrested for being black, you know, driving while black, taking a nap while they're black, going to Starbucks while they're black. People are really, and this may sound funny to other people who are here, but if you lived in my skin, it would not seem funny at all. I wear a mask, and we want more people to wear it. So what is your message to people about wearing the mask and not becoming a statistic?
Well, I'll take the first stab at this. And let me just say this. Racism existed prior to the pandemic, and it will exist after the pandemic. But generally speaking, the reason why we are suggesting that people wear a protective mask in this instance is because of the healthcare crisis. You don't want to die from the coronavirus, and you don't want to die from an inappropriate use of force either from a law enforcement officer. Having spent nearly 4 decades in law enforcement in this community, I can tell you that I've had the privilege of working with the sheriff and others in this community to make sure that we hire, train, promote law enforcement officers who are sensitive to the rights of all people in this community. And if you have the right people patrolling and supervising, and if you ever see a law enforcement officer that does something that they shouldn't do, you ought to bring that to the attention of that agency head so that they can deal with that individual. I know the sheriff is like me. We don't want bad cops in our law enforcement agencies who are heavy-handed in what they do. And it should be confident to this community to know that there was great deliberation about whether we would mandate the wearing of masks. And one of the reasons why that decision was made was that we really didn't want to arbitrarily create a system that would put law enforcement at odds with the citizens of this community. So the decision, we looked at the greater good in this case. Do we have compliance? Are people working with us? Are they helping to protect themselves? And we had to come to the conclusion, or we came to the conclusion, that the answer was yes. They are voluntarily compliant with this. So was it necessary? Did we have, again, the supplies, an adequate supply for people to be able to meet that need? And so sometimes, you know, as an African American, you know, that grew up in this community, I've been exposed to circumstances when I was treated unfairly, but I didn't let that paralyze me from still doing the right thing. So to every African American male who's out there or female who encounters law enforcement, I say that you should comply with the directions that you're being given at that time and complain later, okay? Complain later if you believe that you've been treated unfairly. There's a process that's set up in place for you to be able to air out your concerns, and I believe that these law enforcement executives who are here now will take that under advisement and do the right thing.
So, Mr. Porter, racial profiling is something that I take extremely seriously. There is a mechanism in place if someone thinks they were racially profiled. I'm not aware of any incidents that have happened, but again, I take it very seriously. I have terminated officers for treating people based on their race, and will do so again. So if anyone from the community has any concerns about racial profiling, especially as it relates to wearing a mask in this community, when 99% of the people in our community are already wearing masks, please bring that to our attention. And, I like what the mayor said, that, cooperate with law enforcement, and then complain, call a supervisor, call me, and I will find out exactly what happened. And like I said, that's something I take extremely seriously and won't tolerate.
Dr. Pino, you also mentioned something about trying to get more tests out. I saw an interview with the president of Howard University, who's also a physician, and he talked about aggressively testing, particularly in the African American community. As the tests were originally set up, as the testing was originally set up, there is no site in historic like Paramore, even though the health departments in Paramore is kind of weird. But what does it look like? What is aggressive testing going to look like in the future? Because we all talk about flattening the curve, but honestly, nobody knows how many people have the virus in them that may be asymptomatic. And until we get a serious, slice of the community, we're really not going to know how far blown it is. So what does aggressive testing look like? What is it that you foresee?
So, during the years of training and preparation that you do for something like this in your lifetime, this is a lifetime event for anyone who works in this profession. The training always has been that you have to test your entire universe in a pandemic environment so that you can separate the positive from the negative. And in the negative, you continue to test periodically to identify new positive and extract those people from the community. And when I mean extract, I mean isolate or quarantine so that they are out of circulation, and there you will be decreasing the possibilities of transmission. But that step is over. We didn't have enough tests. Has been all over the place that we were not prepared or adequate prepared, so those are not news. But the news is that no matter how we go from here, what happened with the virus, we have to create a system where we can able to identify individuals earlier in the transmission cycle. Imagine that people are getting infected right here, then they develop symptoms at 5 days. Even if you test on day 5th, it will take another 3 or 4 days to get a test. By the time that you know that the person is positive, right now in the system that we have, all transmission already happened because you have 4 or 5 days more, and the person normally by 7 days, some of the symptoms may have disappeared. So that's the challenge. We are doing a step 3 and we skipped 1 and 2. So in the future, like any other diseases, like we learn from HIV and have learned from others, we have to have a sentinel system in place that will allow us to know what's happening in the community and be better prepared to track those networks, to track transmission, and to be able to identify cases early on so that we effectively can stop transmission.
Okay. And Mayor Dyer, you've talked very strongly and very eloquently about the importance of social distancing, and the city's gone through measures to make sure to try and cut down on people just kind of gathering and doing stuff that we need for people to stay inside. Well, you were talking about that last Friday. Commissioner Regina Hill was having a youth program that the city sponsored over at Barker Park. It seems to be a mixed message. Should people stay inside or should people go out and play?
No, they should absolutely stay inside, only go out for things that are essential or necessary. We do recognize that recreation is essential and necessary, especially for your mental health if you're staying inside. But any recreation that we're doing, we encourage social distancing. So that same thing, wearing a mask, keeping at least 6 feet apart. And we recognize that in some cases, we've had a lot of people in Lake Eola Park, for instance, that with all the downtown condos. So we're putting park rangers out there to try to help and assist people in their social distancing. And another issue, we ended up taking down the basketball goals. We took down the volleyball nets. We're putting wrapping around the exercise equipment that are on our trails so people won't or won't use those. So we're taking all the steps that we can, but there's no straying from the message that staying inside, staying home is the most important thing that we can do. And if you have to go out, wear your mask and socially distance.
Hello, it's Samantha from Fox 35. This question kind of goes hand in hand with the conversation we just had. It's about the 5 new testing sites. How soon can we see those, and are you guys giving special consideration to those communities that have lack of access to healthcare and limited transportation to get to those sites, such as the Orange County Convention Center and over at UCF? Recently, I've heard a lot of concerns that there are no testing sites on the west side of Orlando.
Yes, it would be one in the west side. I'm getting to know the county, so I don't know the parks by name, but will not like to announce it yet as they are not solid. But I'm pretty sure that we will have the collaboration of the county on that. There's never been a question on that. With regard to transportation, so people may not know, but the health department has tested at home. When we have someone that has been incapacitated and cannot leave the house, we have sent nurses to their house for people to be testing. Not that many cases. We are very selective because we are bringing someone in someone's home, and there are some risks associated with that for our employees. We also have offered transportation to individuals. With the help of the county, we are in possession of 2 of the link buses that you use for medical transportation. So individuals that have limited mobility or have some serious issues of transportation, we have provide that. And we also have provide transportation for people who are getting discharged from the hospital with COVID-19 and other situations as well to facilitate that. Yes, it's going to be distributed all over the county. It is intended to favor those people who live in that area, and it is actually intended for people to walk to the site if they can, because we are interested in those people that are normally not engaged with the healthcare. And part of our activity, we could see when we engage an increase in the number of cases, and that will be reasonable and expected as we go and dig more for it. When should we expect this? We are hoping that by Friday or Saturday we could have the first site running. But we will let you know probably 48 hours in advance.
My name is Edgar Carrillo from Telemundo, and I have a question in Spanish for Dr. Pino. Doctor Pino, hemos conversado el día de ayer con personas de este zip code 32822, líder de la comunidad, incluso con la comisionada Mayra Uribe también, y es una zona que está muy challenged socioeconómicamente, hay mucha necesidad, y ellos, además de que hay un porcentaje alto de enfermos, también hay un porcentaje alto de pobreza. ¿Qué planes tienen para atender esta zona? Una de las propuestas que tenían era llevar las pruebas hasta allá por la dificultad que pueden tener para trasladarse. Y también quiero que haga el comentario que hizo inicialmente, lo más importante de los mobile sites en español para ellos, por favor.
Yes, the question was what we're going to do to address the issues at one of the zip codes that has the highest concentration of cases, but also a high concentration of Latino population. Yeah, they ask me always to say it first in English. So that, and also what are our plans to address those issues, and to repeat in Spanish what we have said about the mobile sites. So con respecto a los sitios móviles, vamos a tener 5 en el condado, en las 4 esquinas, norte, sur, este, oeste, y vamos a tener en el centro de la ciudad. No hemos determinado si va a ser en el estadio de fútbol o si va a ser en el edificio nuestro. La idea es alrededor de 250 a 300 casos de pruebas diarias, dependiendo de la disponibilidad que tengamos de los test kits. Tenemos suficiente ahora, por lo menos, para hacer una semana de pruebas. Y parte de la situación con el sitio, y esto lo vamos a entender luego cuando analicemos más la base de datos. ¿Cuáles son las características socioeconómicas del virus? ¿Cómo se comporta en la gente que vive en mayor número en un apartamento, la gente que tiene menos condiciones económicas para comprar una máscara, para comprar los guantes, para comprar el limpiador, o por personas con muchos niños o donde haya varias generaciones viviendo. So hay muchas cosas que debemos analizar al respecto. Just to recap in English, I have mentioned that we will bring in testing to the site, to that area in zip code 32822 and other zip codes around the county in the four corners of the county and the center. And the idea is to increase testing for those who don't have access and normally are not engaged with the healthcare system.
Okay. Other questions?
Yes, this one's coming in from Melissa Thomas. It's for Dr. Pino. Dr. Pino, now that the Orange County Convention testing site is under state jurisdiction, does that alter the sharing of data collected from the test between the state and Orange County? Is the process of sharing that data now easier or faster?
It is faster, it is easier, and no, that will not change. The data is mandated reported by labs as well as the sites, so there is triangulation that goes on to verify those data.
TV to Dr. Pino. Any update on whether you all can potentially speed up identifying patients by race so we can get more accurate data on whether this is impacting certain demographics more than others?
Yes, we have the data by race. It is as accurate as it can be right now. Again, it's a little bit different in our county than other areas of the state or the country. We have a higher percentages among Caucasian, but also we have to see who is getting tested. And that's a different data set because what I'm talking about is positive. It could be that we are testing more Caucasian than other groups. And that's why these mobile sites that are going to go into the heart of the communities are important to be able to assess those issues as well.
And just two more, one more for Dr. Pino. This one's from Jennifer Marcel from El Sentinel. Nut Witkowski, previously the head of the Department of Biostatistics and oh my goodness, I can't even say this.
Epidemiologist.
Thank you. And research design at the Rockefeller University in New York City said in an interview that the coronavirus could be exterminated if we permitted most people to lead normal lives and shelter the most vulnerable parts of society until the danger had passed. He claims that the only thing that stops the disease is herd immunity. What are your thoughts on this, and would that be something Florida could be ready to confront? And she wants her question answered in Espanol.
Oh, en español? Oh. La inmunidad del grupo, la inmunidad del rebaño, es como se llama, es el nivel de inmunidad que tú adquieres para una enfermedad en la comunidad. Y por supuesto, el nivel de inmunidad del rebaño determinará, no esta, pero cualquier enfermedad, cómo se transmite. Mientras más personas estén inmunizadas, más difícil es para cualquier enfermedad progresar en la comunidad. So the question was, well, you guys heard the question in English, but the answer was that, of course, herd immunity has a big role to play in stopping the spread of any disease, not just this one. But herd immunity can only be acquired by experiencing the disease or by immunization. And this is the first round of this disease, and I hope that we have an immunization before we have to face a second.
And Mayor Demings, this one's from Ryan Lynch with the Orlando Business Journal in regards to potentially opening up businesses when that time comes. He goes, with the conversations that you had with local business leaders on restarting businesses, what could that plan look like?
That plan could look like the requiring of some form of social distancing to include reviews about occupancy levels to where we may reduce occupancy levels. It could include the mandate for certain screening to occur, the taking of temperatures in certain types of businesses or whatever before people enter. It could mean additional sanitary protocols for employees of certain types of businesses to require them to wear masks or other things, or gloves, etc. So we will talk through that. If there are no other questions, what I would say to you this week, in addition to the focus to slow or stop the spread of the virus, that's always in a pandemic our primary goal. Secondary goal is to really increase testing this week. That's our focus, increase testing. And the third goal, I think, this week is to begin the planning process for reopening businesses at some point in the future. So those three goals this week, stopping the spread of the virus, okay, 1, 2, to increase testing, and 3, to begin the planning process for the future reopening of businesses. So by the end of this week, our goal is to report back to our citizens where we are along those 3 lines. Okay.
One quick question for Dr. Pino. I'm Justin Soto with News 13. Just wanted to have you clarify again, how confident are you in the leveling off data that you guys are seeing, and what do you need to see exactly to know when we're in the peak here?
So I got that question earlier. Steve was asking, you will know when you are off the peak, when you are coming down. I mean, there are predictive models. They change every day. It changes with the data that you enter. We would like to see sustained decrease in the number of positive cases. But also, if we test more, we will find more cases. But also the rate on which those positive cases are coming back. And now we are in single digits. Just to give you an example, the highest that we have been has been 11%. Right now we are 8 point something or very close to 9. And places like Miami, they have, for example, New York was at 24%, and Miami is at 17%. So those places are really hot. We are now there, and we hope that we don't get there. The data is showing us that 2 or 3 things. First, social isolation and distancing is working. It is working, and we must keep it going this way. The second thing that the data is showing, that people are respecting our wishes to not go to the ER if you don't need to. The ERs are fine, and the health systems are managing their inventory very well. Progressively, what we have to do is increase our testing capabilities, test as many people as we can, and eventually go into IgM testing that will also give us great results with regard to the data and how deep the penetration of the virus was in our community.
Okay, well, thank you all very much. Hopefully this has been informative for you. Every couple of days we endeavor to brief you formally through a press briefing, and so we will look to likely Wednesday of this week. Thank you.